Good morning, I'm Steve Nan Liu. My student number is 991413588. Today I'm gonna do my head-to-toe assessment. I bring three papers. One is falling risk score. Another one is the Cardex. The last one is the Brandon pressure. Yeah, the score is 21. You can find it way. That's all three documents I got total. So I'm gonna start my head-to-toe assessment now. Okay, thank you. Knock knock. Perform the hand hygiene. Hi. Let me check the resident's name. Hi. Hi, Mr. Smith. How are you? So I'm Steve. I'm Steve Liu, the student nurse from Sherman College. First of all, may I have your full name and date of birth? Okay, Smith. Gender, yeah, man. Date of birth, 1964, March 1st. Okay, let me double check with your MRN number. Okay, thank you very much. Okay, today I'm gonna ask you a few questions about your health history and take the head-to-toe assessment to you. All we discussed, all the information I get will only share with your healthcare team. Is that okay? Okay, thank you very much. Now I'm gonna provide the privacy, and I just shut the door and make the certain on. Before this, I have to check environmental safety to make sure there is no spills on the floor and no sharps around under the table. Everything's fine. Okay. I will assess BP and the respiratory rate, pulse, and oxygen status, and the pain levels. That's all. Okay. If the residents report any pain or short of breath, I will use the PQRSTU framework to collect the subjective data for the further assessment. Now, let's do the first part, is the narrow part. The narrow part, we're gonna according to the Cardex. According to the Cardex, we find that Mr. Smith, his falling risk score is 2, means he has the lower risk of the score. And according to the bed and pressure risk assessment, his point is 21, means he has the lower risk of the pressure ulcers. According to those two scores, we're gonna at least give two nurse interventions. First of all, we're gonna put the bed on the lowest position and lock it down, and put the core bears within the touch. And because he has to, he can walk with supervision. So we have to make sure when his walk must under the caregiver's supervisions. Okay, let's go to the narrow part. First of all, when I come into the room, the residents' eyes follow my body. That's the spontaneously to me. Secondly, I will ask him some questions about, can you tell me your full name? Do you know which year or which season it is? Do you know where we are? The resident's response to me corrected properly, means the resident is alert. Residents oriented times 3. So when the resident answer me the question verbally, articulate and properly, I noted the resident is calm, and in his face expression there is no anxieties and restless. I can continue to check the residents and the eye contact, the pupils. Okay, please look at my nose and be careful. Okay, and check. Watch the lights. Right. Okay, if possible, looking at the tips of the pen. Yeah, I noticed when I move the pen light from the side to the middle, the resident's pupils is when the light drops close, the pupils is constrict. When I move the light away, the pupils dilate. When I move the pen closed, his pupils is diverge outwards. When I close to his face, the pupils diverge to the center. The pupils is show the equal and round and reflected to the pen light and accommodation. Now let's do the next part. To the next part of the four lips. Would you mind lift your upper lips for 5 seconds? Yeah, hold it. Okay. Okay. Would you mind hold my fingers at the same time for 5 seconds? Oh, good. 3, 4, 5. Then would you mind lift your right legs for 5 seconds against the back? Good. 1, 2, 3, 4, 5. Another side. 1, 2, 3, 4, 5. Okay, the last one is would you mind push your face to my hands? Yeah. Okay. Now pull your toes back to your head. Okay. After I check the four lips and I feel the lips strength, they have the equal side strength and strong and equal. There is no any problem. If we have any problem, we're gonna. Okay, let's move to the next part. Next part is respiratories. Between the respiratories, we're gonna first of all we're gonna check the physician's order with the oxygen orders to make sure the order is correct. We're going to check the oxygen meters on the wall. Make sure it's accurately it's 2 liters to the resident. We have to check the installed tubing to the resident nasal part. It's nothing broken or leaking, and it's not tinted. And under the face, the nasal mask is properly fit. His body sealed. There is no any redness and skin broken down, and the nails and the ears. Okay, now let's go to the check the skin part. We're gonna check the resident skin for the front. We make sure that the skin is okay. There is even color, no any tenderness, pumps. And the resident, do you have the shot of the breath? Okay, no shot. I'm gonna put you on the comfortable positions. Okay, I'm gonna put comfortable position at 60 degree to check. If they put comfortable, we can check if the resident take the accessory muscle to help the breathing. Oh, okay, it's fine, not breathing. It's the normal. They don't use it. Now I'm gonna use my stethoscope to do your vasculation. Sorry, I just bring my stethoscopes. Yeah. For the stethoscopes, because first of all, I'm gonna use the diaphragm side to check the front side. Okay, here we can check the top of the clavicles. Use the Z patterns. 1, yeah. You can use the nose inhale and use the mouth exhale. When I speak in out with the group count, you can do the same pattern. Okay, in out, 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 in out. Oh, I'm gonna check the lateral side. In out to the fifth intercostal space. On the other side, the posterior side, the same thing. We're gonna start from the top, to the top to the T10 to the bottom to check the lung field and the bronchial side and tracheal side. We can from on the left side, in out. Still follow the Z patterns. In out, 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 in out. After finish this 7, we're gonna do 8 and 9, but 8 and 9 spots at the lateral side. In, out, in, out, in, out, in, out. Okay, I finished all the part. All the residents' lung field sound is clear and equal. There is the air entry is follow the regular sound. There is no any crackers or whistle sounds are healed. But if I healed, I will notate the timing, locations, loudness, and the pitches. Okay, thank you. We're gonna do the next part of the cardio's part. Cardio's part, first of all, I gonna check the first things is the apex pulse. We're gonna check the apex pulse and compare with the radial pulse if they are at the same. I will use the stethoscope and the diaphragm side to check the apex side. The apical area is on the left middle clavicle side, fifth intercostal spot. Left middle line of the clavicle and the fifth intercostal ribs. Okay, here, laptop. Meanwhile, I gonna check resident radial pulse. Laptop. Just to make sure those two pulse their rate is the same, regular strength and the ransoms. Okay, the resident apical sound is the regular thing. It's okay. We're gonna do the next part to escalate residence 4 part of the cardiac part. First part is the aortic area. Second one is the pulmonic. The third one is the tricuspid area. The last one is mitral. The right side, second intercostal space down to the middle of the clavicle lines. Laptop. Use the diaphragm side. Okay, left side pulmonic area. The same thing, but another side. Left side, the middle clavicle side, and down to the second intercostal space. Laptop. Okay, the third one is the tricuspid area. Left side, the middle of the clavicle, down to the fifth intercostal space. Laptop. And the last one is the mitral area. The same thing, but literally a little bit same. The fifth intercostal space. Laptop. Okay, after this, I feel that the resident cardiac sound is okay. But on the top of 2 spots is the aortic and the pulmonic. The S2 sound is a little bit louder than the S1 sound. But at the bottom is the tricuspid and the mitral is S1 sound is is louder than the S2 sound. Then I will change the diaphragm, use the bell part to do it again. Still follow the Z patterns. Laptop. Now to double check the absence of the murmur sounds or abdominal sounds. If I feel the abdominal sound, the crackers or the whistles, I will ask the patient to lie down again and then turn to the left side to recheck all the sounds again. Or I can put the resident on a high forward position, leaning forward a little bit, do all the assessment again to make sure the absence of the murmur sound. And I will notice the 7 spots. One is the timing and the pitching sound and the loudness and locations and qualities and patterns and radiations. Those 7 things I should focus. Okay, after the cardiac part, I gonna check residents and other things about his capillary refills. We're gonna check residents the fingers or the toes. We gonna just press here for 2 to 3 seconds to check if the blood will refill back. And we're gonna check residents the leg size. If they are symmetrical. If they are not, we're gonna check they have the widest circumference, widest part if they are symmetrical. And we're gonna check residents here. The feet, she has the So Sally's pelvis, pulse here and here, if they are equal and strong. And we have the second one is the posterior tibials. It's under here, ankle. Use 2 fingers, tibia, same side. Okay, last things we're gonna check residents' pretibial edemas. We just use the fingers to press their shin for 5 seconds to make sure there is no edema here. Push, no edema, okay. Now we're gonna move to the next part. After cardiac part, we maybe go to the skin checking. At the beginning of the skin checking, we have to check the residents the IV side, because if resident take the IV side, yeah, she has IV. We have to make sure IV side skin is okay. There is no any bruise, no any skin broke down or the redness on the IV side. And IV connections should not be tinked. After the IV checking, so we're gonna check the residents, inspect the resident's skin considerations. Oh, I have to lift up your gun. Sorry for that. First of all, we're gonna check resident's skin consideration to make sure there is no any. They have the even colors, no tenderness, no lesions, no masses or tenderness on his skin part. Okay, after skin check, according to the Baden risk, residents on the lower risk, but we have to make sure the odors is within is not older than 7 days. After the skin check to make sure there is no tenderness, we're gonna use our hands to touch the resident's skin. We use the dorsal surface. Use the dorsal surface of the hands to check resident's skin to make sure the skin is warm. And we can use the anterior surface to touch resident skin to make sure their moisture is dry, and the dressing somewhere is dry. The skin is dry. After the skin part, if the resident skin has some issues, we have to double check with their temperature, texture. And temperature and skin moisture and yes, that's all. After skin check, we're gonna do the last part of the GI and abdominals. Abdominals should be the first of all, choose the catheter. If the resident has a catheter, we have to make sure the catheter is correctly. They connect to the skin part. There is no any brokers here, so there is no leaking. It's lower the body. And we ask the resident the questions. Okay, do you feel do you have any vomiting or any nausea? No. Okay, do you have what's your last part? Do you have passed the fall? Yes. Okay, what is the last bowel movement? When you urinary, do you feel any pain? Do you still follow the previous pattern of the urinary? So we're gonna keep the hourly check about output, about the urinary volume and the colors and the clarities. We ask the resident the question, use the plain language to make sure they can understand it. Okay, last part, we're gonna do the abdominal check. We still use the catheters. Stethoscopes. First of all, we use the diaphragm side to check resident abdominal front right lower quadrant for 5 to 30 seconds. Outer to inner, and clockwise. Outer, inner. Then we use another side, the bell side, to check the aortic, renal, each side by side, iliac, side by side, femoral, arterial, to make sure there is no bruise. And before the area here, when we check the bowel sounds here, we have to make sure there is some gurgling sound and the high-pitched sound in the diaphragm for the 8 spots of the bowel sound here. Because silent is not acceptable. If silent means something wrong, we have to hear something. And the second part, use the bell. We have to make sure there is no bruise. Okay. The last part, we're gonna palpate. Use our 4 fingers to palpate the abdominal part. Still follow the same patterns. 1 centimeter low, parallel to the body, and we're gonna check the residence is equal. Is the flat to the round. There is no any redness here. Make sure the umbilicus is in the middle, that's symmetrical. We just brush 1 centimeter to make sure there is absence of the madness. We're gonna leave the last part for the resident report to the pain. If he report to the pain, we're gonna leave the last part of that one to do the access. After this one, if the resident report any pain or tenderness, we have to note it the most of things. One is the moisture, temperature, and texture, and involuntary guardings and radiations. Okay. After all, that's all. Thank you for your watching. Okay. We're gonna be back to double check you. I'm gonna put you back on the lowest position and make sure the resident confident that everything on the Colbert within touch. Okay, that's all. Thank you.